Hello everyone, welcome to the YouTube channel MEDICO'Z Factory. As we have discussed in earlier session, various transport pathway associated with absorption topic. So today we will continue next session of absorption under pharmacokinetics. Do subscribe the channel and I hope you guys will find content helpful for you all. So next is bioavailability, the rate at which fraction of drug administered for desired action. That means we administer drug to patient and the action of that drug give us the desired result. This is simply bioavailability. IV route has 100% bioavailability because drug direct enters systemic circulation. Term bioavailability is used commonly for drugs given by oral route. Equivalence, it means comparison of two different products. First is bioequivalence. These all are the definition useful for exam purpose. I will explain you in easy and brief manner. So the first is bioequivalence. That is, if two drugs produce equal bioavailability, that is bioequivalence. Next is chemical equivalence, where dosage of drug is same although brand is different. Example is metazine and calpol are different brands of PCM. Third is clinical equivalence, that is action of drug produce same effect of pharmacological effect in body. Example is metazine and calpol, both are used as antipyretic drugs. Last is therapeutic equivalence. Structurally different two drugs can provide same clinical effect. Now I will explain you more precisely. If two drugs produce treatment with desirable action is termed as TE. Suppose drug A and B can produce same degree of diuresis. They are said to be therapeutic equivalent. Now we will discuss factors affecting bioavailability and absorption. These are IMP for exam point of view. So first is disintegration and dissolution time. Disintegration word itself says to disintegrate, that is, divide into small fine particles. Then it is converted into solution, that is, dissolution time, and get absorbed. You can see same thing in graph. Example is liquid dosage is fastly absorbed, hence solution is more absorbed than suspension, then capsule, and then tablet. Example is aspirin. Hence, liquids are absorbed faster. So the next factor is particle size. Smaller the size, faster the absorption and bioavailability. Hence, particle size are directly proportional to surface area. Hmm. So, powder form is better to absorb. Example is aspirin and digoxin. Third is salt form, means neutralization of acidic and basic drug. So, faster it gets converted into solution, the greater is bioavailability. Example, salt form of tolbutamate sodium has more bioavailability than its free form. Same for phenytoin. Next is crystal form. Powder form has more bioavailability, that is amorphous form. Example, amorphous form of chloramphenicol palmitate has more bioavailability than crystalline form. Next is water of hydration. Drug plus water forms hydrates. Drug containing no water has more bioavailability, that is anhydrous form. Example is ampicillin. Vascularity, greater area, more blood vessels, more absorption. Example is small intestine because it is the longest organ of body. Next is excipient or adjuvants. Excipients, pharmacological inert substance. Pharmacological inert substance like starch, lactose, gum, sulfate are added to formulation as binding agents. It increases absorption and increases bioavailability. Example is digoxin, levodopa, and phenytoin. So the next is ionization. Degree of ionization depends on pH of the medium. So strongly acid and strongly basic drug remain unionized at all pH. Example is aspirin, pethidine, etc. So the next is pharmacological factors. First is gastric emptying and GIT motility. As drug reaches intestine, more surface area, more absorption, it increases bioavailability. Next factor is food. Drugs are faster absorbed in empty stomach but not relatable with all drugs. Example is increased absorption of tetracyclines if taken with milk, not empty stomach. So the next factor is first pass metabolism. This is very important topic for exam point of view. As you can see in the figure, drugs go into stomach, then disintegrate and dissolute, and then goes from the hepatic portal vein to the liver and then systemic circulation. Again, the same cycle keeps repeated. This is first pass metabolism. During the process, certain drugs gets inactivate and it decreases bioavailability. Example is lignocaine, it inactive in liver, and second is isoprenaline in the gut wall. Hmm. Consequences of high first pass metabolism. To increase bioavailability, drug undergo extensive first pass metabolism. To get this result, best preferred route is IV, as we have seen 100% bioavailability. Dosage of oral drug is more than systemic route. Example is diclofenac. When it gives as oral route, dose is 50 mg. Same drug, when it gives into injection, dosage is 25 mg per ml. Next factor is drug-to-drug interaction. One drug can affect the bioavailability of another drug. So, when you take two drugs at a time, in that case, drug-to-drug interaction is seen. Example is probenicid decrease excretion of penicillin. and antacids decrease bioavailability of tetracyclines. You can see route of administration. Bioavailability of IV has 100%, subcutaneous and intramuscular has 75 to 100%, and oral has 5 to 100%. So the highest bioavailability of IV is 100%. So thank you. I hope this session is helpful to you. In case of any doubt, use comment section, and please subscribe the channel and like the video and share your friends. Have a nice day. Bye bye.